Everybody, welcome back. This is Dr. Stephanie Wallace. I'm one of the adolescent medicine pediatricians with the Department of Pediatrics. I have with me Dr. David Kimberlin. In addition to be a pediatrician with me with Children's at Alabama and UAB Pediatrics, he actually is an expert and a liaison to the CDC's vaccine committee. And that's the committee that makes our recommendations on how vaccines should be used. So I welcome you guys to join us as we continue our conversation about COVID-19 and what the Birmingham community should think about when it comes to moving past COVID-19 and getting back to life as normal. Dr. Kimberlin, in our earlier video, we were discussing about the vaccine. Many of our parents and youth are really on the fence about getting the vaccines for themselves. What do you say for those who have concerns about the safety for the vaccine and are still having doubts about being vaccinated?
You know, these vaccines are remarkably safe and they are phenomenally well studied. Hundreds of millions of doses of these vaccines have been given across the United States and even more across the world. And the safety monitoring mechanisms that are in place have really allowed us to characterize these vaccines even more than I would suggest any other vaccine we've ever used in children or in adults. We know a tremendous amount about these vaccines, and what the take home from it is that they are incredibly effective. They will with a very high degree protect a person who is fully vaccinated, gets 2 doses of the mRNA vaccines or 1 dose of the J&J vaccine. It will protect them with high degrees of certainty against severe infection, needing to be hospitalized and dying. So that's obviously that's pretty important. And then in terms of side effects, basically they cause a sore arm. They may cause a little bit of chills, maybe some low-grade fever. When that happens, number one, it's very short-lived. It's like less than a day. And number two, it means that your body, your immune system, your immune response is doing what it's supposed to do with the vaccine and generating the kind of protection that then will keep you out of the hospital when you get exposed to the virus in the future. And notice that I said when, because there is so much of this virus out there right now, so much of it that it is inevitable that we will come in contact with it. What we need to do is put on that body armor of the vaccine to try to minimize the likelihood that it can harm us.
Yes, and I was going to ask, I've had to answer a lot of questions in our clinic about how fast this vaccine came to existence. And there are a lot of questions and concerns about the safety in that regard. Can you reassure our public that even though things moved quickly to get these vaccines into the arms of doctors and healthcare professionals, that it really was done with safety in mind?
I definitely can, and I appreciate very much the ability to address that question, because it is one that I hear as well, Stephanie. I mean, this is something that it's an observable fact. This thing happened quickly. I would suggest that's what we want in a pandemic. We've had over 630,000 Americans die of COVID. And so do you want to take the slow road or do you want to get things done fast? I would say we want to get it done fast. Now, since the mid-1990s, I've done clinical research that's funded by the National Institutes of Health. So I'm very familiar with the sequence by which a study is developed, implemented, run, analyzed, and so forth. And what happens during that process is each of the key components gets done, but there's enormous lag time, up to like 6 months lag time between step number 1 and step number 2, or step number 5 and step number 6. All they did last year with the development of these incredible vaccines, these miraculous vaccines, is they shortened those intervals. They shortened the linkage periods of time between the important steps. All the important steps were done. They were done with exceptional oversight, and they were done with huge numbers of people, 40,000, 45,000 people per study, which is the exact same size that any vaccine trial would have. So it was the same degree of rigor. It's just the interval times, the down times were shortened in order to get a vaccine that could save lives more quickly.
And if I can also add, I know I've had to ask questions about long-term side effects, that because it was done and it's so new, that we don't really know about some of the long-term side effects. But I'm familiar that we've been following side effects for vaccines, and we do that for many years afterwards. So the fact that we are still following it in the medical community doesn't mean that there are any concerns about long-term side effects. We're just following the process that's already in place for us to take care of our youth and everybody receiving the vaccine. Am I correct in that?
Oh, yeah, you're absolutely correct. And the only additional thing I would add is that, we've had over 200 years of vaccinology, that is the development of vaccines. And consistently across 200 plus years, from smallpox all the way to the current vaccines, when we see a problem with a vaccine, it's within the first 6 weeks. It's not 18 months later. It's not 6 months later. It's in those first few weeks after the vaccine is administered. And that's the reason with the authorizations that the FDA has made for the vaccines, they followed the very last subject enrolled in the studies for at least 2 months. And with the approval that's just recently come out for the Pfizer vaccine for 16 and over, they followed those subjects for 6 months and longer. So I have a high degree of certainty that what we know about the vaccines and the side effects of the vaccines, and they do cause a sore arm. That's a known side effect. I experienced it. But what we know is what we're going to continue to see. I do not think we're going to see any surprises down the road. And I promise you this, if there is a surprise out there, it will be detected very quickly, because the degree of oversight, the degree of safety evaluation and follow-up, as your question or your statement previously acknowledged, it's unlike anything in the history of humankind. These are the most observed vaccines, monitored vaccines that we've ever had, and they are exceptional in terms of what they do.
Let's discuss people who haven't gotten the vaccine or interested in getting the vaccine, and what trouble that may be for their families and our communities, and our desire to return life back to normal, not only for us as adults, but more importantly for our kids. What will happen, or how serious will the effects be if we are not able to find a way to continue to overcome or get past this pandemic?
We've got to have enough people immune to the virus that it can't find new people to infect. And the way to do that is through vaccines. If we let everyone get infected with the virus, we would have millions and millions of dead people in the United States alone. And that's simply not acceptable. None of us would want that. So what we have to do is get everyone vaccinated. And in order to do that, we have to really get the word out that's the person's individual responsibility. You hear a lot about that phrase, I have a right to say no to the vaccine. That's the sentiment that I hear. And I would suggest that that's not fully correct. And let me give you an example. If I'm on a high blood pressure medicine, I'm not, but let's say I was, and I personally decide not to take that medicine anymore. I just say, hey, it's not for me. I'm not going to do that. Then I have a stroke as a consequence, and I either die or I'm left as a vegetable for the rest of my life. So who gets hurt by that? I get hurt by that. My immediate family does too, but I'm the one that pays the price for that. On the other hand, in this highly transmissible pandemic virus setting, if a person does not get the vaccine and they become infected with the virus, they will become infected with the virus. There's enough of it out there right now. Then not only is their own health at risk, that would be the analogy to the stroke I mentioned before, but they can spread it to other people who then spread it to other people. So for instance, they could spread it to their child who's not old enough to get vaccinated yet. The child goes to school and spreads it to another child who takes it home to mom who's on chemotherapy for cancer, and she dies. So this is not, public health is not the same as personal choice. It's fundamentally different. And I think we need to really reorient ourselves to that. What I choose for myself in the face of a pandemic and of public health has a direct impact on my neighbor and my neighbor's neighbor. And so we have got to all do our part. It's simply that's just the reality of it. And if we don't, then we're going to be dealing with this same issue in 2022 and 2023 and 2024 and 2025 and beyond. We have to do this.
I am with you, and on behalf of both of the institutions that you and I both work with and serve, I am concerned about the resources to take care of not only our patients and our family with COVID-19, but those other healthcare conditions who need the expertise at UAB and at Children's of Alabama. And so I think having COVID-19 and try to prevent the transmission throughout the community is what we should do so that our healthcare resources can help our young people and our adults with cancer, with strokes, and other urgent medical concerns that also come at the doorstep of two of the institutions that take care of a lot of our Birmingham families.
That's exactly right.
Well, Dr. Kimberlin, I appreciate your time this afternoon and this morning, I should say, having this discussion about COVID-19 in our communities and the vaccine for our youth and children. Is there any parting words that you would like for the community to hear from you as we're taking care of our own today?
You know, you can tell by the conversation that we've had, Stephanie and I have been having here for the last few minutes. This is a dire and incredibly serious situation that we're facing right now. But the good news is we have the tools to get beyond it. And those tools are, for right now, ultimately it's vaccination. And as the vaccines are increasingly being administered to more and more people, it's masking and trying to keep some degree of social distance and so forth. And we've got to do it. You know, right now our hospitals literally are overflowing. You know, for the last week and a half, we have been in negative numbers in terms of ICU beds across the state. In other words, we have like 70 people that need ICU beds and we don't have any place to put them. And those aren't all COVID patients. Those are patients that have been in major car wrecks and so forth. We have got to do this. The good news is we can. We just got to have the will to do it. And I believe wholeheartedly in the goodness of the Alabamian public. We will do this. I hope and I pray that it'll be soon.
And for those looking for more information, you and I both represent the Academy of Pediatrics. I know all of our colleagues out there across the state and across the country are willing to answer questions. So I ask every parent to have that conversation with their pediatrician, their healthcare professional, their family medicine, the OBGYNs, dermatologists as well. Talk to everybody, medical professional, and get some personal advice on your own, and just hear us talk about how important this is for all of our communities. Thank you, Dr. Kimberlin.
Thank you, Dr. Wallace. I appreciate it.